My name is David Stojdl. I run a research lab here at the Children's Hospital of Eastern Ontario Research Institute. And for the last more than a decade, we've been looking for new therapeutics for cancer. We're trying to use biology to fight biology. So cancer is a moving target. It has many different genetic errors or mistakes. And what they've found, I guess, through decades of sequencing, this sort of ability to read the DNA of cancers, they've found that patients generally don't have one cancer when they present, they have many, many different cancers. So trying to use a drug that targets just one of those errors is doomed to fail, and I think that's what's happened over the last 2 decades or so. So what we're trying to use is biologics, tools such as viruses, replicating viruses, living things that can attack multiple different cancer mutations at one time, as well as harnessing the patient's immune response. And so these two sort of powerful tools put together is sort of the approach we've now taken. And in the lab have been working hard to try to figure out the feasibility and the effectiveness of these therapeutics. And after many years of proving they look really good in the lab, we're trying to now get them out of the lab and into the clinic, into patients, and test them where they really should be tested. I think the attitudes around cancer are going to be changing. They're already changing now. It's still a horrible disease, still claiming many lives, and the treatment process is at times quite brutal. But I think that the tools that are coming to the fore, tools that are being built in labs like ours here at CHEO, I think will change fundamentally the way people approach the disease, the management of the disease, and the general outlook. And so I think what I'd like to say is that labs like ours around the world, I think, are now finally starting to reap the benefits of the 50 years of research that has gone into just understanding what cancer is, the many, many talented scientists that have made contributions. Now is the time that those are going to pay off in spades actually for real people in the clinic. I firmly believe it will be happening in my lifetime. And so, I think the community here around CHEO should be proud because they've contributed in their way to making that a reality.